This Health Minute brought to you by St. Francis Health, serving our community for 111 years.
Suicide can affect people of all ages and backgrounds, and new research shows economic and social conditions can be a contributing factor. Mandy Gaither takes a look.
It's a serious public health problem. In the latest data, the CDC says suicide was responsible for the deaths of more than 49,000 people in 2022.
It's a largely preventable form of death, so we have a lot of opportunity to reduce those numbers, but they are high.
A new CDC report is providing more evidence that social and economic conditions play a significant role in efforts to prevent suicide. Researchers found suicide rates in 2022 were 26% lower in counties with the highest health insurance coverage, 44% lower in counties where most homes have broadband internet access, and 13% lower in counties with the most household income.
Increased access to healthcare, and especially mental health care, and making that affordable is something that matters a lot.
Dr. John Ackerman with Nationwide Children's Hospital says communities need to play a role in suicide prevention, and so do parents. He says to talk to children about suicide.
It's been shown that we don't increase the risk of suicide when we ask a question like, have you ever thought about ending your life? Or have you had kids in your classroom that are struggling with harming themselves or saying that they don't want to be alive?
Ackerman says it's also important to safely store unsafe objects in the home, including medication and firearms, and make sure children get involved in things they care about.
They're fostering opportunities to grow and learn and make connections, and that they know that they're not alone.
For Health Minute, I'm Mandy Gaither.